There's a national dental meeting going on right now, and they're not hearing this stuff. And they're not doing mini implants, and they know nothing about ozone. So how does the profession change? It changes with each and every one of you. You're it. You are the masters of progressive dentistry, changing our profession with this information.
We're starting something new here, folks.
Complete mind shift.
Hallelujah.
This is the place to be. This is the profession. Just wait, you're in for a rocket ride.
Bleeding is the key. It's not about the pockets anymore.
We caught that disease because that patient never had bleeding gums, and all of a sudden you have bleeding gums.
I cannot tell you how elated I was to find out about these blood tests. There's going to be some bleeding in Rockdale just as soon as I get that stuff.
The general public's going to be asking about ozone, and 98% of dentists are still going to go, I don't know anything about ozone.
In one visit, they can leave your office with implants and teeth. It's going to be easier than doing a root canal post. I earned $500,000 more in 6 months after doing the mini implants. Within an hour and 40 minutes, we had a complete upper roundhouse bridge with 12 implants. Here she is immediately after the procedure. She went out to dinner with us. We had a full course meal with her. And then the next morning, we took her to the Pancake House and had breakfast with her, and then we took her to the airport, and she flew back to Texas.
We'll go ahead and place the bridge in place. In an hour and 10 minutes, we've successfully placed 10 implants and cemented Stuart's entire fixed bridge.
You already have the marketing, you already have the staff. I'm going to show you how to take some of your current assets, capture them, new patients in 30 to 90 days.
So if I can stop your clench, I'll take away all your headaches. Hard and fast. Good. Looking for me? Fascinating. We've got this interference over on tooth number 2, coming up all the way up to the front. She has a crack on the distal of tooth number 31. Now, the crack on the distal of 31, or that little crazed line, corresponds to what tooth above it? Tooth number 2. The prematurity shown up in the computer is tooth number 2. And your symptoms are going to disappear over the next 3 months. They're going to be gone.
So not only is it being committed to innovation and understanding innovation and trying to do it, but it's also these organizations that we're finding that are really successful have a real process for it. Capture your ideas, then manage them and analyze them.
I work with a lot of doctors who have a lot of neck and back injuries. 12-end exercise, I call it the dental dozen. You're going to see your vitality go up, and you're going to be able to pursue your legacy.
You can do this actually in 20 seconds. It is the strongest natural oxidative agent that we have in the world. It's very fast, very predictable. We're getting fantastic results. It's really that simple. Is there a need for fillings? We're really changing dentistry.
Does that blow your mind?
It saves tooth tissue, it maintains tooth vitality and avoids pulpal exposure. Do patients prefer it? Yes, of course they do.
There's a whole world of complacent and bored dentists out there, and that's too bad because there's so much going on in this profession that's so fun and exciting and fulfilling. I can't imagine not doing this.